Cardiovascular disease is a term used to describe conditions that affect the heart and blood vessels. Decades of studies have shown there's a strong link between diabetes and cardiovascular disease, particularly hardening of the arteries. Let's look at a few recent studies that help us understand this link. In a large study of people living with type 2 diabetes, more than 4 out of every 10 people also had some form of cardiovascular disease. Either heart disease caused by blockages in the arteries that supply blood to the heart, a history of stroke, and/or disease in the arteries of the legs and feet. More than 8 out of every 10 adults living with type 2 diabetes also had high blood pressure or high cholesterol, factors that increase the chance of developing cardiovascular disease. This study told us that nearly 95% of people living with type 2 diabetes have either some form of cardiovascular disease or multiple risk factors that greatly increase their chance of having cardiovascular disease in the future. However, a lot of people don't know about the link between type 2 diabetes and cardiovascular disease. And understanding this link is important because studies show that you can lower your risk. In the 8-year-long STENO-2 study, people living with type 2 diabetes were split into 2 groups to compare treatment approaches. The usual care group received regular treatment for their diabetes. Treatment in the intensive group was designed to achieve stricter targets for blood sugar, blood pressure, and cholesterol levels. At the end of the study, people in the intensive treatment group had fewer heart attacks or strokes than those in the usual care group. We now also know that people in the intensive treatment group lived 8 years longer. In the Swedish National Diabetes Registry study of people with type 2 diabetes who did not have cardiovascular disease, researchers found that for each risk factor at target levels, a person can lower their risk of developing heart problems. And if a person with type 2 diabetes has their risk factors well managed and does not smoke, their chance of developing heart problems is similar to a person without diabetes. Everyday habits such as eating a healthy diet, being physically active, giving up smoking, getting enough sleep, and managing stress can all help lower your risk of heart disease. Medicines can also play an important part. Ask your healthcare provider about your risk of cardiovascular disease and how you can work together to reduce it.